Hi, everyone. A very good afternoon to you all. My apologies for the delay in start of the session. Sometimes technology can also be a disabler, so sorry for that. But thank you for your time and patience and for coming for this session. My name is Dr. Gauri Kulkarni. I head the medical operations at MediBuddy. I am a practicing family medicine specialist, and today, as part of our Women's Health series this month, we are going to talk about cancers, specifically cancers in women, and what can we do about it in terms of understanding, detection, screening, prevention, and even treatment, right? So it's important that we understand these aspects of cancer. We'll be specifically talking about breast cancer and cervical cancer because they're the most common cancers in women. However, if time permitted, we will also go into talking about colorectal cancers and lung cancers and so forth as well. Right. So please do come up with your questions. You can type it out in the Q&A section. I'll try to take them as many as I can to the best of my knowledge. And please stay till the end of the session so that you can ask questions as they may come up to you during the session. Right. So let's begin by first understanding, right? Of course, everybody knows what is a cancer, right? Cancer is abnormal cell growth, and it is what we have seen is there has been an increase in the cancer presentations over the last couple of decades. So even if we have to say that just about in the 2020s, like 2000, we're just going about 20 years back, right, where we were seeing that the proportion of women having cancer, right? Say, for example, we had to talk about breast cancer. Women about 20 years back, the detection rate and people diagnosed with breast cancer was about, say, 7 to 8%, which is now increased to almost 14%, right, of all cancers seen in women. So we know that the burden of illness because of cancers is increasing. And this is because of multiple reasons, right? There are increased risk factors that we are seeing, be it our lifestyle, be it our exposure to, different chemicals, be it, presence of other chronic factors which are contributing to increase in cancer incidence, or even the fact that there are better screening and detection tools which are helping people to detect it early on and get treated as well. So on one hand, we see a rise in the proportion of people with cancers. We're also seeing an increased number of people who are also showing remission, which means who are successfully getting treated for cancer as well. So there has been advancement in medical sciences to that extent as well, right? So we have to understand both sides of it. Now, but naturally, cancer is something which is definitely a very, if I have to say, it is a burden of illness, right? The burden of illness of cancer is very, very high. Now, this burden is not about just the physical aspect of it for the person who is suffering from cancer, but it is also at a mental health level for the patient, a person. It is also the social aspect of the person for their family and caregivers, financial burden, psychosocial burden. So there are so many aspects of the burden of illness that cancer brings in with. And hence, it's important that we take measures to, find and ensure that we take the right screening tools and ensure that we are detecting cancer at a much early stage if it is present, and then getting it treated. Which are the treatments which are available so that a person can have a near normal lifespan, right? So that is the reason why we are having this discussion today. Okay, so as I was mentioning, in India, the scenario, if we had to see about the types of cancers that are most commonly seen in women, definitely breast cancer is highest, then there is cervical cancer, right? So in India, according to WHO statistics, almost 14 to 14.5% of all cancers detected in women is because of breast cancer. of which the mortality is also highest because of breast cancer. This number two is definitely cervical cancer, which is around, say, about 12 odd percent of all cancers which are seen in women. Then followed by lung cancer, lip and oral and lung cancers, right? So these are the, I would say, top 4 or 5 cancers that are seen in women, right? Women specific, of course, is the breast and the cervical cancer, right? The other cancers which are also quite common, the next would be, say, cancer in the stomach, the food pipe, other leukemias, cancer in the larynx and the pharynx here, in the throat cancers. So they are the next in line after these top 4 that we spoke of, right? So as I said, the burden of illness of cancer is increasing day by day, right? So if we had to see uh, a cumulative risk, right? A cumulative risk of development of cancer. Currently, it runs at around, 1 in 8 has a risk of actually developing cancer, which is a big number, right? 1 in 8 causing cancer is like, a one person in a family, right? Which means that it is important that we take screening very, very seriously, right? Now, on one hand, the numbers show a staggering rise in the cancer prevalence of in women, but it also is seen that parallelly the survival rate has also increased, right? From, say, in the last 4 decades, the survival rate of breast cancer has improved post treatment. It has improved from, say, somewhere around 50% to, as high as 85%, right? But see, survival rate also depends upon a lot of things, like the stage of illness. When was the illness diagnosed? At what stage was the illness? How severe was it? Naturally, the survival rate is inversely proportional to the stage at which it was detected. So if the higher the stage, right, a person who has already touched stage 4, and that is when the person has been detected, naturally the survival rate will be much lower, right? We have to understand that. And hence early detection is beneficial for long-term survival, right? Also, it's said that almost 90% of all stage 1, stage 2 cancers can actually be cured, right? Especially with breast cancer and cervical cancer, it's been seen. However, the percentage goes down as the stage increases, right? Majority of people who are in stage 4, we know that it is not curable, but there are still treatment available to make or prolong the survival in a meaningful way, right? That is definitely possible even in stage 4. So we have to understand where screening and early detection comes in, right? Now, if you look at from a timeline perspective, right? When a person doesn't have a disease and of course is asymptomatic, right? So they don't have any symptoms, no disease at all. But then there is a time when they don't have symptoms, but the disease is present, right? This window where the disease is present, but there is no symptom, this is where it is important that we do early screening and early diagnosis and detection so that treatment can be started early on. Because the later the detection, the difficult is the treatment, the poorer is the survival rate, right? And hence it's important for us to understand that window period from a natural history of disease perspective, right? Now, let us talk about breast cancer first, right? So you know that presentation of breast cancer typically is, a lump or a bump which is seen, or a lump or a mass which is felt within the breast tissue, change in the morphology of the breast tissue. There could be change in the skin, there could be oozing from the nipples, there could be, swellings which are seen in the armpit, there could be change in the, from a systemic perspective of, say, weight loss or fevers or anything like that. So lot of things can be very easily seen. Skin changes such as, say, ulcers or redness or change in the look of the nipple, like there is puckering of the nipple. So a lot of these things can be seen as symptoms. But really, by the time that this is seen, it might be actually too late, right? And hence the reason that we need to undergo screening, right? Now, again, screening is something for breast cancer that we say is helpful specifically for all individuals, but definitely with those with high risk. Now, who have a higher risk of getting breast cancer, right? People with a family history of breast cancer. So somebody who has had their mother or first degree relative, mother, sister, aunt, who have had cancer, these people are definitely at a much higher risk because there's a lot of times there could be a genetic component. We know that breast cancer gene 1 and 2, BRCA 1 and 2 are genetic predispositions to cancers, and they may be expressed, and hence the need for doing detection and screening early on, right? The other thing is definitely a number of pregnancies. If the age of first pregnancy has been later, or there is the duration of menstruation or the start of menstruation has been very early, that could be another reason for risk in with breast cancer. Or use of HRT or hormone replacement therapy. If individuals or women are exposed to hormone replacement either pre or post menopausally as well, for treatment during menopause, then the risk of breast cancer is again high, right? So we need to understand that these could be the other risks are definitely obesity, weight gain, again, are risk factors. Abnormal period cycle is again a risk factor, right? So these are the risk factors that we see with breast cancer. It's important that if somebody does show any of these, one should go ahead with screening. Now, the basic thing, what can you do at home, right? When in terms of breast cancer screening. So the most simple thing is called a self breast examination. Very simple, right? When do you need to do it? You need to do it on a monthly basis, right? Typically in the first half of your cycle, right? So if your period cycles are of say 28 to 30 days, then the first half of your cycle is when you do your monthly self breast examination, right? So typically how you do it is by looking at yourself in the mirror first to see how your breasts are looking, right? They are symmetrical, they are how is the movement? Do you see a change in the shape of one over the other? So look at the pattern that you see when you're looking at yourself in a mirror, right? Along with that, one needs to gently examine oneself typically in the reclining position, right? Where you need to touch your breast with your the middle part of your hand, right? And then try to feel for any lumps or swellings, right? And naturally, you have to understand that the way you would touch your breast, and this is something very easily that can be trained to you by your doctor, or there is enough material which is available online where you are able to check for any lumps and bumps upwards from the nipple, downwards from the nipple, from outside towards inwards towards the nipple, and all around the nipple. That's how you go it, right? So up towards, from above towards your nipple, from below towards your nipple, from outside towards your nipple on all directions, and then circular around the nipple, right? And also going all the way towards your axilla, which means that your armpit, to look for any lumps or swellings in the armpit as well. So this is something that you can do on a monthly basis. It is recommended that everybody does it on a monthly basis, so that if you feel anything, then it's a good idea that you would be going to a doctor, right? The next, of course, is something called as a clinical breast examination, naturally, which means that it is done by a clinician or somebody who is trained to do a breast examination, right? It is said that clinical breast examination definitely helps in, better in terms of identifying, possibility of a breast cancer. So it's a good idea that you need to go to a doctor on a regular basis, once in 6 months to a year, to get your examination, clinical breast examination done, right? So it is simply because it is done by a trained professional or a trained personnel. The sensitivity and specificity of doing a clinical self-breast examination is higher. It usually varies anywhere between say 70 to 85%, right? So that's the reason why it is recommended. From a diagnostic perspective, as in from a screening, from a diagnostic test perspective, right? There are many tests which are available, but screening test for specifically breast cancer is called as mammography, right? Mammography is basically a digital mammography where it's a specific type of X-ray which is used to look at the breast tissue, right? Now, the recommended, agreed upon time period for breast cancer screening is every 2 years, right? It is routine screening for breast cancer should be done once in 2 years, along with clinical breast examination, right? And this is preferably should be done by all women above the age of 45, right? That is a recommendation. However, in India, because the prevalence of cancer is increasing, at some places we also ask women to do it from the age of 40 as well, right? But usually above the age of 45 is a good idea, because that's when most women start going into a perimenopausal age group, and where the incidence of cancer of breast is much higher. All right. So naturally there are two tests now in India. If you go to your the diagnostic lab, though the gold standard test for breast cancer screening is digital mammography, a lot of places this particular machine may not be available specifically, and then they do what is called as a sonomammography, which means an ultrasound of the breast, right? Now we have to understand that, of course, these are two different tests, and one is not um, over the other, if I can say that, right? Um, digital mammography is definitely the gold standard. However, if the availability of digital mammography is not there, one should still go ahead for sonomammography, in my opinion, right? So that is something that that one should do if this is not available, right? So, but of course, there are pros and cons to each, right? Because we know that digital mammography definitely is gold standard. There is still some amount of radiation exposure there, that when you are doing a mammography, definitely, because the breast tissue is kind of compressed between two plates when there is an X-ray is one goes through the test, there could be some breast discomfort that can happen. But the good part about mammography is definitely it can help in detection of microcalcification. It can help in detection of very small minute changes also, which maybe an ultrasound may not pick up, right? It can also be completed much faster because it's just an X-ray exposure and then the film is there. Ultrasound, on the other hand, is definitely dependent on the person who's conducting it, right? So it is use of sound waves rather than radiation, if I can say that, right? It can be used as supplemental test, definitely, but it is much better when talking about, say, benign cysts or water-filled cysts which are there, which we may want to check out for. It definitely is less discomforting as compared to my mammography, but unfortunately it cannot help in detecting, say, microcalcification. Many a times, if the breasts are heavy, one may not be able to see the entirety of the breast tissue, and deeper areas may be missed out, when you're doing an ultrasound. So those are the things that those are the things that we have to keep in account when you're doing the test. But if you're going to the doctor and you have the option of doing the mammography as a screening test, then my recommendation to you is to go ahead and do it at least once in 2 years, right? Naturally, the incidence of breast cancer itself is definitely much higher in the older age group, right? As one grows old, so about the age of 50, definitely it is much prevalent, right? But the lower age group is as it is significantly present as well. So it depends on your choice, that what would you want to do. But as a doctor, I would recommend that everybody undergoes a screening test for breast cancer and undergoing a mammography every 2 years, right? Now, of course, if you do find, right, if there is something that does come up on a mammography, right, that's the thought process, right? And especially, if you are somebody who already has a family history or you have an increased risk, as I was saying, right, then the screening, because you need to start screening much earlier. Like, for example, if you have a family history, right, then your screening should start at the age of even 30, right? Or maybe even younger, right? And where annual mammograms are recommended, right? Specifically, if this is a genetic breast cancer where there is a BRCA1 or 2 gene expression is there, and you have had a family history of somebody having a cancer which has these genetic expression, then you should do your mammographies much earlier, as early as 30, right? Um, so it's important that we understand that there is no upper limit as such right now about when we should stop doing breast cancer screening. However, to the best of my knowledge, about the age of 70, maybe the risk to benefit ratio is not as much in terms of screening tools, and because there could be other comorbidities which affect a person much more than breast cancer itself. So say my recommendation to you would be, if you have a strong family history, started at as early as 30. Otherwise, if you don't have any history, started at the age of 40. Definitely between the age of 50 to 60, you should get your mammography done regularly. Ensure that you do your clinical breast examination get it done every year. Do monthly self breast examination. And if you do all of these things, it will only ensure that your risk of cancer in terms of getting detected later is reduced. Okay. Great. So let's go ahead with cervical cancer. Right now, this is again another group of cancer which is again very common in India. We see on an average about 12 to 13% of all cancers in women because of cervical cancer. Cervical cancer is basically cancer of the cervix. Cervix is the mouth of our womb, right? So all women have uterus, and the ending part of the mouth of the uterus is called as cervix, and that is the place where there can be cancer growth. Okay, so it's important that we understand where this cancer is. Now, this is an interesting cancer because this cancer is usually caused because of persistent infection because of a virus, which is called as the HPV virus, right? Or human papilloma virus. Okay. Now, 99% of all cervical cancers are because of the HPV virus, specifically subtypes 16 and 18, right? So there are different subtypes. And it's a sexually transmitted disease. So this is one of those cancers which we know the causative organism, right? So this is one cancer which is caused because of a virus. Interestingly, this is a cancer for which there is a vaccine which is available, right? So young girls, prepubertal girls, can be given this vaccine. However, this vaccine is also available for all women in the reproductive age group, and it is recommended for everyone to take it to reduce their risk of getting cervical cancer, right? So this, we have to understand that this is something which can very well be prevented at our end as well, right? By taking vaccination, by following safe sexual practices as well. Okay. So it's important for us to understand what are the screening tools, right? Now, cervical cancer screening can detect very early changes as well, right? And of course, we have to understand that if it is untreated, right, it can lead to invasive diseases, right, where it can affect, it can cross cervix and go towards and spread to all parts of the body as well, right? Now, this is also one of those cancers which sometimes is not very invasive. So it can go without showing symptoms for a very long period of time. right? So there is a long latency as well. So a lot of people may not even recognize or realize that they have a cancer until very late, right? And hence the reason for early screening and detection, right? So what is the screening tool for cervical cancer? It is called as pap smear. Okay, what is a pap smear? It is basically a smear of the cells from the cervical canal, right? So here, when you go to a professional, they will be able to take a sample or a scraping of the cells from the cervical canal from underneath, from vagina. So when they do it, they look at these cells which they have got from the cervix under a microscope to see the type of cells that are seen. Okay, so typically the cells which are seen on the microscope, they are of a certain dimension, the way they look, right? And if they are deformed, it is a sign of a possibility of early cancer or cancer for that matter, right? So that is the reason why this test is important. Okay, so now the question remains is only pap smear to be done? Not really. There is a combination of pap smear along with HPV testing. HPV is human papilloma virus. So it is basically to test the presence of this virus or the antibody towards this virus and the cervical pap smear. These two together form a screening tool for people to undergo to detect for cervical cancer. Now, who should, and what is the age group, right? So I usually recommend that the HPV testing, right, should be done for women under the age of 30, right? But along with HPV testing, a routine pap smear should be done for all women above the age of 30. Okay, and this should be done at least once in 2 years. Okay, now how will this help? This will help us to know if there is any abnormal cells when they have done the pap smear, and they will also see the presence of the human papilloma virus, right? So both. And so it's recommended that you undergo these screening tests once in 2 years from the age of 30. Now, if you are in your, if you have young girls at home, prepubertal age group, ensure that they are getting their vaccines for human papilloma virus. HPV vaccine is available. If you're in your reproductive age group as well, it is recommended that you take the vaccine. These vaccines come in 3 doses and they are taken in intervals, first dose, then second dose is in 2 months and then in 6 months, and is recommended for all women in their reproductive age group to reduce the risk of cervical cancer. However, it is the benefit of the vaccine is highest when it is taken in the prepubertal age group before the child or before the person is sexually active. Once you become sexually active, then the risk of course, exposure to HPV is higher for obvious reasons. However, the recommendation goes that even if you are sexually active or in your reproductive age group, you must go and get the cervical cancer vaccine taken for preventing or reducing the risk, not preventing, but reducing the risk of cervical cancer. Okay, so that is the recommendation that we give for cervical cancer, right? So hope that is clear for everyone. Before I go towards the other cancers, I would want to talk about cancer prevention. I think that's very, very important. I see that there is a question that has been given, so I will take that up before I go ahead. So someone is saying, I'm 25 years old and doctor has recommended ultrasound test for breast. On ultrasound, detect whether the lumps are cancerous or not. Is biopsy required to detect whether the lump is cancerous or not? Yes. So if there is a lump found, okay, then yes, it is required that biopsy is done, right? Because we need to know what is the cause of the lump. Now, different lumps can look quite different. In my opinion, along with ultrasound breast, you should also do mammography, which will also give you better understanding of the type of lump, right? A lot of times women also have, and this is very, very common, called as benign fibroadenoma, which means they are non-cancerous lumps in the breast. It is quite common. However, If there is a lump, it is a good idea to check if it is benign or malignant. Benign means it is normal, it is not cancerous, but malignant means it is cancerous, which means it needs to be taken care of, right? Quickly, treatment and everything has to be given. So if on ultrasound there has been a lump found, then it is recommended that you undergo a biopsy to check if it is what kind of lump it is. All right, I hope that answers your question. Great. So let's go ahead with right. So there is some myth about mammography as well, if that is safe to be done regularly. Fantastic question, Yes, mammography is basically a specialized form of X-ray, if I can say, right? It's basically the X-ray of the breast, okay? Now, X-rays are basically radiation, so you're exposing yourself to radiation. However, the amount of radiation exposure is quite minimal. And when we say that this has to be done once in 2 years only, the total amount of exposure will definitely be lesser as compared to the possibility of getting a breast cancer if the detection was not done. Correct? So I hope you understand that. Yes, like I said, the pros and cons of we were discussing the pros and cons of, say, mammography, right? So it is definitely the gold standard test for breast cancer detection. It can detect very, very minute nodules and lumps as well, which would otherwise be missed out on an ultrasound. It is also very quick to do. However, yes, it causes discomfort. It has a small amount of radiation exposure, right? In ultrasound breast, the thing is that it is also dependent on the person who is doing it. When the breast is bulky and large, many a times it is difficult to see all areas of the breast. The ultrasound or the sound waves will not reach to the every part of the breast, and hence there could be limitations to the reporting of an ultrasound breast, right? Ultrasound breast, however, is very useful for cystic lesions, which means water-filled lumps in the breast, and it can help in even draining it as well, right? Of course, it's not as discomforting as mammography, but my suggestion is that you should undergo the gold standard test, which is mammography. Do not worry too much about the radiation exposure or the little bit of discomfort that it will cause. Ensure that you get it done according to the guidelines. You don't need to do it every 6 months or every year, right? You have to do it once in 2 years, and that too, the frequency or increase in frequency of the screening depends on the risk factors. So if you have a very strong family history, then you may have to do it once every year. But otherwise, you don't need to do it every year. All right. So I hope I've answered your question about the cancer, breast cancer detection. Fair enough. So great. Can you do a mammography while breastfeeding? I usually recommend not to do it. If you're breastfeeding your child, that means your child is most probably less than 2 years. So that time I would recommend that if you have to do a test, do an ultrasound breast. Okay. There's another question which says, is it effective to take the cervical cancer vaccine after delivery of first child? Great question again, right? So as I was mentioning that cervical cancer vaccine is best when taken in the prepubertal age group, right? In India, we are still recommending it only for girls and women. In the West, it is also recommended for boys as well and men as well, right? Because they also get warts and lesions which are sexually transmitted to them as well. So it is recommended for them as well, but we will restrict our talk to what we usually recommend in India. So as I said, in the prepubertal age group, it is the best to be taken. However, all women in the reproductive age group can take the cervical cancer vaccine. The issue is here that if you have already been exposed to, the HPV virus, which we do not know, right? So unless we do the HPV testing and we do the pap smear, we will not be able to know this, right? But so the efficacy of the vaccine reduces if you already have an exposure, but that doesn't mean that everybody has had the exposure, right? So even if you are in a reproductive age group, it's recommended that you take the cervical cancer vaccine even after you have delivered a child as well. Okay, so you can go ahead and take it if you're in reproductive age group. I hope that answers your question, right? So great. Let me just quickly scan through the great. So there is a question which says, what does superficial and intermediate squamous epithelial cells along with scattered neutrophils and lactobacilli in pap smear mean? Great. So these are the different types of cells which will be put. So pap smear is basically, as I was mentioning, that it is basically through the vagina. There is a spatula which is or like a scoop kind of a thing which is put in, and the scraping of the inner lining of the cervix is taken, and then it is looked under the microscope. So when you're looking at the cells in the cervix under the microscope, it will tell us the type of cells that are seen. So typically, squamous epithelial cells are the most common type of cells, and that is what is normally seen in the cervix. So this is something which is a normal cell type, cervical cell type to see in cervix. It also says that there are neutrophils. Neutrophils are basically our fighter cells, and lactobacilli are common bacteria which are seen in our cervical canal. It is a normal thing to happen. So if you are telling me this, this is more or less like a normal report. Maybe there's a mild infection that you have. That is the reason for neutrophils being seen. So you may want to go to your gynecologist, and they may give you some kind of an antibiotic or some kind of a medication, because there could be a possibility of a mild infection that you're carrying in your cervix, right? But otherwise, it seemingly is a normal. It doesn't show any abnormal cells as such. Okay, great. Okay, so I think I am done with most of the questions here. Can I take the cervical cancer vaccine if I am post-menopausal? Well, again, very good question. The risk of cervical cancer is typically reduces. The risk of breast cancer increases as age goes up. The cervical cancer, not as much. So it is usually not recommended in the postmenopausal age group. It is usually recommended in the reproductive age group only. So my answer to your question would be may not be required. I would always recommend people to continue following safe sexual practices, because that helps in keeping the HPV virus away, right? So hope that answers your question. Great. So great. So there is a question which is here, which says that what will we do so that cancer will not hit? Correct, which means that what I understand from this question is that you want to know what are the preventive measures, and I'm going to take, say, 5 minutes of everyone's time to discuss about prevention of cancers, right? So let us talk first, before we talk of prevention, I think it's important that we talk of risk factors, right? In general, for all cancers, right? Let's talk about risk factors. So the first, we will always talk about personal or dietary factors, right? So obesity is a very, very important risk factor for breast cancer, right? We have to understand that. Lack of regular exercise, and smoking. Okay, so these are very, very important risk factors that we need, which are in our hand, right? We can take care of this. So it's important that if you are somebody who smokes, you should ideally quit smoking. If you're someone who has a sedentary kind of lifestyle, are above your BMI weight, then you need to take care of it by ensuring that you are keeping your weight within the BMI, as well as taking care of regular exercise. So that's number one, right? So that's about your personal habits. Dietary habits, right? If you are someone who takes a lot of processed food, which has, usually a lot of preservatives, uh, again, the risk is high. High foods which are high in sugars, laden with sugars, alcohol, um, uh, you know, uh, you know, food which may have like laced with say pesticides or insecticides, those are again increased risk of cancer, right? Other things are like exposure to toxic substances, right? Even exposure to radiation, say solar UV radiation, excessive tanning, excessive sunlight exposure can cause skin cancer. Exposure to certain toxins, can lead to cancers. Secondary smoke, outside air pollutants, asbestos, increase in coal or charcoal, smoke inhalation, that can cause it. Family history of cancers, again, can be increasing your risk. Certain infections, as we were talking, right? So, the HPV virus, as we said, other cancer causing viruses like hepatitis, which causes liver cancer, or even HIV leads to increase in, cancer growth, cancer cell growth. So those could be reasons. So there are a lot of multiple risk factors that I can say which can lead to, someone developing, uh, cancer. So it's important. So even before I, because we spoke a lot about breast and cervical cancer, let me tell you, in general, for cancers, always look for warning signs, right? If there is any change in bowel or bladder habits, if there is any sore that you have in your body, which does not heal, okay, any unusual, say, bleeding or discharge, right? Say, for example, in cervical cancer, if you have intermenstrual bleeding or postmenopausal bleeding, or post intercourse bleeding, right? Any of these could be signs of cervical cancer. Then any lump or bump that you see, like for example, in breast cancer, there could be thickening or lump in the breast, right? Problems such as, difficulty in swallowing or ingestion, that could be a sign of cancer. Any change or any new mole, or any kind of a discharge from a mole, or an increased size of a mole suddenly, that could be a, possibility of a melanoma, or any kind of skin cancer. Any nagging cough, right? Cough which just is persistent cough, or any change in the voice, that could be also a sign of cancer. So always have that in your mind. Along with that, constitutional symptoms, say, persistent fever, on and off fevers, change in weight, that could be again a sign of cancer. So if you have any of this, right, do not delay, getting it checked. Sometimes it's okay to, get your doctor regularly and talk about any changes that you may see in yourself, and get it checked, examined, and maybe investigated as well. So in general, from a prevention perspective, I always say a few things, right? Number one, I always say stop smoking, right? That's number one. Look at your diet. Are you somebody who has excessive processed food, a lot of sugars, alcohol in diet, or your choice is too much of red meat? Again, they're all increased risk of cancer. Obesity, again, is again an increased risk. So, trying to get your weight back into your BMI range. As I was mentioning, that certain infections, to keep yourself away from certain type of infections, to safe sexual practices, to avoid HPV vaccine or virus, or HIV virus, or even hepatitis B. So again, that will help in prevention of cancers. Trying to take care of pollution, again, difficult, but trying to keep away from air pollution. There's benzene in the air, there is asbestos in the air, so many things are there, coal tar. So best is to use a mask and try to keep yourself healthy that way. But those are the few things that you can do to try and prevent cancer from happening. However, a lot of things which are not in our hand, So, for example, if your family history is there of possible or which increases your risk of cancer, then get yourself, ahead of your game and ensure that you're screening regularly so that there can be early detection and treatment. Okay. There are a couple more questions, so I'm going to just take up those questions. So there's a question which says, apart from pap smear, what is the other test to detect HPV virus, right? So, okay, let me again clarify. Maybe I was not very clear. Pap smear helps in looking at the cell type, the cells which are there in the cervix. It really will not tell us if there is a HPV virus. Okay, pap smear is called as cytology, which means it looks at the type of cells which are there in the cervix. So are they normal cervical cells? Are they abnormal cells? What is the look of the cell? That is what it tells. HPV screening is basically to screen for looking at specifically the HPV virus. Okay, so that is HPV testing. Okay, so human papilloma virus HPV testing, which is done, this is a different what do you call that? It is not a part of the it cannot be detected by the pap smear, if I can say that. Okay, so so I hope that you understand that there is a difference between the two. All right. So so HPV test and then pap smear test, right? These are two different tests which are to be done. Okay. And they definitely together. I think one is not about the other. They should be done together, I feel, for better detection, in my opinion. Right. So that is the basis behind doing the tests. Hope that you understand that. All right. So great. Let me just quickly have a. What are the symptoms of cervical cancer? Again, wonderful. I think we just briefly touch based upon it. But just to tell you, the most common symptom is called as what we call as intermenstrual bleeding, or it could be post-coital bleeding, which means that abnormal vaginal bleeding. So, after a coitus or after an intercourse, you see there is bleeding happening. Or you say that, you have passed your menopause and then suddenly you start bleeding again, right? You have a period. Now that is definitely a sign of possible cancer. Any unusual discharge, right? Vaginal discharge, right? Can be a sign of cancer. Loss of, say, bladder control, or say pain during intercourse, unexplained weight loss, pain, pelvic pain, we say that, feeling of something is weighing down in your pelvis, could be again a sign of cervical cancer. So there could be multiple symptoms, but the most common symptom that is there is abnormal vaginal bleeding, which means either there is post-intercourse or post-coital bleeding, or there is post-menopausal bleeding, or bleeding which is in between, which is outside of your regular periods, right? That's the most common symptom of cervical cancer, right? Do we have any exercise for the breast to save from cancer? There is no specific exercise. What we try to say is that you need to lose weight, or if you are on the overweight, if you're out of your BMI range, then you need to ensure that you control your weight or lose weight to bring it to your BMI, normal BMI. But there are no specific exercises per se for breast to reduce the cancer, breast cancer, right? Great. Are there vaccines for any other cancers? Unfortunately, as of today, no. That's why it's important that we educate everybody about the HPV cancer, HPV vaccine for cancer of cervix. So there are no other vaccines that are known as of today, but hoping that something comes up for hepatitis B and C and other thing, and HIV, I hope so. But currently, no, it's not there. What does an intermittent lump in the vulva mean? It comes and goes. All right. So vulva is for the larger audience, this is a question. So vulva is the outermost part of your female reproductive system, right? Which is seen outside, right? And if there are lumps coming on the vulva, there could be multiple reasons. The most common reason could be infection, right? So there are certain glands within the vulva which are there, which can swell up because of an infection. So that's the most common reason. If it is absolutely in the outside, it could be just, hair follicle which has got infected. We don't know. So it's important that if you do have a lump, get it checked, because it could be just a part of an infection. A very common thing is called as Bartholin cyst, very commonly seen. Or it could be as a hair follicle infection. So it has to be checked really to see what it is. But go to a doctor. I feel that will be the best thing, because get it examined once to know what is the cause of it. But these are the two most common reasons for a lump in the vulva. Okay. Are there any side effects of a cervical cancer vaccine? Also, can it be given openly, or you need a prescription from gynec? Ideally, you should go to your gynec or your physician who will advise you. I do not think it is available just like that. So you can go to your physician or a gynec, and then they can prescribe it to you, and then you can get your vaccine done. No, there are no side effects per se of the cervical cancer vaccine, like any other vaccine, right? You know that every vaccine will have some amount of, because it is the purpose of a vaccine is to kind of help in generation of antibodies towards a possible infection that can come later. So naturally, there might be, say, a mild fever or mild pain at the injection site, but otherwise nothing serious in terms of side effect. All right. Can white discharge from vagina be a sign of cervical cancer? So see, white discharge is something which is very common in women for multiple reasons, right? The most common reason for a white discharge can be that it is just physiological. All women have some amount of discharge, vaginal discharge, right? Which increases and decreases according to the cycle. Other reasons where it is copious amounts, it can be because of different type of infection, be it, say, fungal infection, there could be bacterial vaginosis, there could be many other type of infections which are there, right? Which is causing the white discharge. So if you are having a white discharge, the first thing is that you get to your doctor. They will most probably do an examination and a smear as well, to high vaginal swab rather, to check what is the type of infection, and then accordingly treat it. But if it is something which is not an infection, then yes, it can be a sign, but not the first sign of cervical cancer. The more common cause of white discharge is usually an infection or physiology. Okay, but get it checked any which way. That's the right thing to do. Right. I know that we are at the very end of our time, but I'll take a couple of questions, and then we'll just wrap it up after that, right? So one of the question is, what does a small pea-sized lump in the inner breast? It looks more like a pimple. Okay, so I'm unsure of what you mean by inner breast. Like, is it, how did you find it? Like, was it inside the breast tissue, or is it on the skin? If it is on the skin, then it could be even a skin infection. You have to get it checked. But if it is felt inside the breast tissue, you understand, feeling inside the breast tissue is when you're holding the breast tissue from both sides and you can feel it inside the breast tissue, then definitely you should get yourself examined by a doctor, and then if required, a mammogram as well. But it is something which is on the skin, like you can get acne on the skin. It is very common also to get skin infections around the breast skin as well. It could be that. But I'm unable to decipher it based on your question. So good idea is that you get it looked at by a doctor as well. Okay. There's another last question which says, what is fungal infection of vagina? Well, fungus is like any other organism. You have bacteria, viruses like that. Fungus is an organism which is very commonly causing infection in the vagina. It's called candidiasis, is the most common thing that happens. It leads to curdy white discharge from the vagina, along with intense itching and irritation felt in the vagina and the vulva, right? It's a very common infection which happens. It can happen because of change in the pH of our our vaginal lining, and very commonly seen and can be commonly treated as well, right? There are antifungals which are available either as an oral medicine or preferably as a suppository, which means you can put the medicine inside your vagina, and fungal infections can be easily treated. If you have it, I usually recommend that you go to a doctor. Do not stay with the fungal infection because it is quite difficult. It can be quite annoying because of the irritation and itching and the smell and the curdy white discharge that you see. So please do get it checked if you do have it, right? Great. So are there any treatments for fibrocystic breast disease? Well, fibrocystic breast disease are typically benign illnesses. We were talking about benign and malignant. So benign are those which are non-cancerous, and a lot of women have it. So it depends. A lot of times women have fibrocystic diseases, and they have it and they live with it and nothing happens. However, it is something which is causing discomfort. If the size is very big or it is causing discomfort, the solution to it is surgical removal, but it is not something that needs to be removed if it's a benign illness. However, it needs to be checked to know what is, if it is benign or malignant, right? But usually it is benign. Is early age of intercourse a risk factor for cervical cancer? Yes, it is. It is very much. The earlier you are sexually active, the increases the risk of exposure to the HPV, human papilloma virus, and the risk of cervical cancer is that much more higher, right? So I know that we are about over our stipulated time. So let me just quickly kind of concise what we have discussed today. Cancer in women is on the rise. Lot more women are facing cancer as an issue, specifically breast and cervical cancer. The good part is that with early screening and detection, the treatments which are now available, be it surgery, chemotherapy, radiation, all are so advanced that women can have a near normal lifespan if the detection is early, right? So the message for everyone is that ensure that you are undergoing your regular cervical cancer and breast cancer screening on a regular basis to ensure that you are, you're ahead in terms of screening and detection and treatment as may be required. Right. So with that, I will bring this session to an end. Thank you so much for your time and patience and for asking all the questions. We are here to help you in any way possible. So keep yourself healthy, follow the right, screening methods and tools and availability of tests, and take care of yourself so that you can be ahead of cancer. And take care of yourself. So until next time, it is Dr. Gauri saying thank you, stay happy, stay safe, and stay smiling. Take care. Bye-bye.